what is mindfulness? A clear basic definition of mindfulness is a state of open awareness that comes from the acceptance of intentional and non-judgmental action. In other words, it is the basic human ability to be fully present and aware without being overwhelmed with the world around us. When using this facilitation technique, we help a client create a life of meaning, personal growth, and positive emotion. Mindfulness is something that we are naturally good at, but it benefits us only if we practice it daily. One of the ways to practice mindfulness is meditation. There are 3 different types of meditations discussed in the book. The first is formal meditation. This form of mindfulness requires you to remove yourself from your daily activities to either exercise, meditate, or do other types of practices. The second type of meditation is called informal meditation. This is when you bring awareness to your daily task, for example, while breathing, showering, or even watching a sunset. You can do informal meditation. The next type of meditation is called moving meditation. This is when you actually cultivate mindfulness in activities. It's actually the most common type of meditation. Moving meditation is the most common type because that's where you use your yoga, your tai chi, or when you do flexibility or balance exercises. Another concept that we do well to know is that mindfulness is based on cognitive behavior therapies. These include mindfulness includes stress reduction therapy, and these practices are used to navigate emotions, thoughts associated with behavior in order for us to help change it. It's good to keep in mind also that due to the evolution of mindfulness across time, culture, and purpose, there's no actual clear consensus of the definition for mindfulness. Mindfulness intervention are used in different populations, and these populations can be delivered either clinically, community-wise, or in educational settings. Most therapeutic recreation specialists will incorporate stress management in their program as well as in their wellness programs. Mindfulness techniques have proven to help with anxiety, depression, psychosis, post-traumatic stress disorder, cardiac problems, diabetes, and even hypertension disorder. The 3 most important characteristics to keep in mind of mindfulness practice are intention. Also, we want to think about attention as well as attitude. History-wise, we want to think about mindfulness as it's actually a way of easing psychological suffering, as well as cultivating insight on personal. Mindfulness practice originally emerged from the Eastern philosophies and tradition of Hinduism and Buddhism. So the monks who were very religious, they practiced mindfulness, and mindfulness was mostly popularized by the East religious and spiritual institutions. Recently in the West, its popularity kind of began to grow, and more people started to know about mindfulness, and the mindfulness practice really started to emerge in the 1960s during the Enlightenment period, where a lot of people did a lot of research about enlightenment, but it wasn't until the 1970s that the introduction of mindfulness was used in medicine and psychotherapy, which is different from its traditional use, because the Buddhist priests would use it as they would fast, and they would believe that enlightenment would actually bring them closer to, mindfulness would bring them closer to enlightenment. Mindfulness, we want to see that it contributes to the overall well-being of our clients through the elevation of three things: positive emotion, reduction in distress, and increased value of life. When we think about the positive emotion aspect of it, a patient's well-being is characterized in the way that they practice it. Basically, mindfulness in general, it activates a part of your brain actually that affects, when it's repeatedly used, it affects overall your happiness. It creates an intentional positive aspect of life. It changes your potency to notice positive experiences. Meditative practices also focus on that also focus on loving and kindness and compassion for oneself. Actually creates kind of a result of just positivity and just happiness, even personal growth. Basically, just when you do practice mindfulness, you get an enjoyment on another level, and it creates kind of just a greater quality of life, and it awakens you, and basically you feel more connected with yourself. So it's definitely good as far as for us as recreational therapists. We want to use this modality as a way to help our patients cope, coping with hard times, coping with any negativity that's going on with their lives, whether it be depression. We want to use mindfulness as a way to shift that negativity into positivity, and that only comes with awareness and openness and just self-love. Mindfulness is also good in reduction in distress. It does enhance positive emotion, but it also contributes to it minimizes the needless suffering. So it minimizes anxiety. It minimizes internal experiences that a patient or a client might be experiencing. Mindfulness reduction. I really enjoyed how the book said that mindfulness kind of it reduces the individual's likelihood to be kind of trapped in their mind, kind of hooked, because it increases the person's ability to see the value in their lives, and to have these life goals, and to just experience kind of a clarity.
Over 1,000 research studies have been conducted on the therapeutic use of mindfulness practices. Research has shown that mindfulness interventions consistently reduce stress, depressive symptoms, ruminative thinking, chronic pain, and anxiety, as well as increased well-being, empathy, and self-compassion. In studies with non-clinical participants, Fredrickson and colleagues studied the effects of a loving-kindness meditation program on a non-clinical population of working adults. Of the 202 study participants, 102 were assigned to the loving-kindness meditation program and 100 to the waitlist control group. The program consisted of 6 60-minute weekly sessions with meditation homework 5 days each week. Data from the pre- and post-test measures showed that the loving-kindness meditation program produced a cumulative increase in positive emotions over the course of the study. Positive emotion, in turn, contributed to increases in mindful attention, self-acceptance, positive relations with others, and good health. The increase in these resources led to greater life satisfaction and less depression. In studies with participants with mental health conditions, Manzano and colleagues examined the psychobiological effects of a mindfulness meditation program on 16 patients ages 30 to 60 with anxiety and depression who completed a 2-month meditation program. Only clients with fixed treatment and no change in medication during the trial period were included. The intervention consisted of 2 guided meditation sessions a week, plus additional home practice. Pre- and post measures of psychological well-being were assessed, and endocrine parameters were collected through blood samples. At post-test, scores indicated significant improvement in psychological well-being. Additionally, levels of parathyroid hormone decreased, while levels of adrenocorticotropic hormone and dehydroepiandrosterone sulfate increased. High levels of parathyroid hormone are related to depression, whereas low levels of dehydroepiandrosterone sulfate and adrenocorticotropic hormone are related to anxiety and depression. In studies with participants with physical health conditions, Curiotti and colleagues studied the effects of a meditation group on the norepinephrine levels and excitatory hormone, cardiopulmonary performance, and quality of life of 19 older adults in recovery from congestive heart failure. Participants were randomly assigned to either a 12-week meditation group or a control group. The meditation group met weekly and were introduced to mindfulness techniques and also practiced at home. The control group met weekly to talk about stress. Pre- and post-test measures included blood norepinephrine levels, quality of life, and cardiopulmonary exercise testing. Participations in the meditation group had significantly better norepinephrine levels, cardiopulmonary function, and quality of life than the control group. Sound clinical judgment is crucial when introducing mindfulness practices. Safety and effective timing are essential. Each participant's functional status, medical history, and fitness level must be evaluated to ensure safety. Triggering of past emotions and experiences can occur when individuals are instructed to place themselves in a vulnerable position. That's why it is important for the therapeutic specialist to be aware of possible triggers, anticipate them, monitor participants continuously, and help them move safely through their occurrence. There are a variety of meditative and mindfulness implementation exercises. In this section, we will be facilitating the progressive muscle relaxation meditation while including adaptations for persons with attention deficit hyperactivity disorder, commonly known as ADHD. ADHD is one of the most common mental disorders affecting children and many adults. Symptoms include inattention, such as not being able to stay focused, hyperactivity, such as excessive movement that is not fitting to their setting, and impulsivity, such as hasty acts that occur in the moment without any thought. Progressive muscle relaxation meditation is a method that teaches its participants how to relax the tension in their muscles, which is commonly associated with stress, anxiety, fear, backaches, and tension headaches. By tensing particular muscle groups in the body one at a time and then releasing that tension, this will help reduce their muscle tension, stress levels, and help participants relax when they are feeling anxious. It can also help reduce physical problems such as stomach aches and headaches, as well as improve sleep. To prepare for progressive muscle relaxation, participants should wear loose, comfortable clothing and remove their shoes. They should find a quiet place to sit and then close their eyes and let their body go loose. An adaptation for a participant with ADHD who has trouble staying still is to have them lay in a reclining armchair but not completely flat to avoid the chance of them falling asleep. Adding music at a volume where they can still hear the facilitator's instructions can also help them focus on their current tasks. Before beginning, it is also important to keep in mind of any physical injuries the participant may have that may cause muscle pain. Also, participants should avoid practicing after big, heavy meals and should not practice after consuming any intoxicants such as alcohol. The first step of the progressive muscle relaxation method is to apply tension to a specific part of the body. The parts of the body include the feet, lower and upper legs, hands, arms, buttocks, stomach, chest, neck and shoulders, mouth, eyes, and forehead. We will start with the shoulders. Take a slow, deep breath. Then squeeze the muscles in your shoulders upwards as hard as you can for about 5 seconds. After 5 seconds, quickly relax the tense muscles in your shoulders. Remain in a relaxed state for about 10 seconds whilst taking slow, deep breaths and then move on to the next muscle. Take a slow, deep breath. Raise both arms in front of you and squeeze the muscles in your arms only as hard as you can for about 5 seconds. After 5 seconds, lower your arms and relax. Remain in a relaxed state for about 10 seconds while taking slow, deep breaths and then move on to the next muscle. Take a slow, deep breath. Tighten your fist as hard as you can for about 5 seconds. After 5 seconds, quickly relax the tense muscles in your hands. Remain in a relaxed state for about 10 seconds while taking slow deep breaths and then move on to the next muscle. You continue this routine for all the remaining muscle groups from head to toe. A progressive muscle relaxation meditation can typically take from 15 to 30 minutes. An adaptation for participants with ADHD would be to lessen this time to a minimum of 10 minutes so that they still get the full effects of this method without getting agitated. To shorten the time frame of this method for a participant with ADHD, instead of focusing on just one specific muscle group at a time, such as each individual finger of the hands or the toes of each foot, they can focus on the complete muscle group instead. For example, instead of just focusing on creating tension in their feet, they will create tension on their entire legs instead. Now remember, to practice often whether you are feeling anxious or not. Practice will lead to progress and allow you to become more aware of your muscles, how they respond with tension, and how you can relax them. It may feel tedious at first, but ultimately you will gain a skill that will probably become a very important part of managing anxiety in your daily life. Thank you.